and what options they're going to have starting 2014. So the goals of my presentation today are just for you to learn some basic facts about who the uninsured are and where they live, learn about some coverage options and what new ones are available as of 2014, and learn about the actual enrollment process and answer some general questions. Like he said, my name is Juanica. Previously, before this, I was a Deputy Regional Field Director on President Obama's campaign, and now I get to work in a nonpartisan atmosphere, which is really awesome for me, and I'm really excited to talk to you guys today. So we'll start there. So basically, like I said, Enroll America is our parent company, and Get Covered America is the campaign. It's a grassroots campaign just to make sure that we get out and actually talk to people and let them know what their options are under the Affordable Health Care Act. So here's a quick summary of the uninsured. This is the United States, of course, and everything that's in the deep, dark red has over 1.1 million uninsured people. Yeah, and you guys are lucky you won the lottery if you live in Florida. 67% of all of the nation's uninsured live in 13 states. You guys are one of those 13 states. And can anybody guess how many uninsured Floridians there are? No one in the front row? No? Okay. Well, there's 3.5 million uninsured Floridians. So for us, we have a really, really big task, right? And of those 3.5 million uninsured Floridians, we did some research. And back in June, Enroll America found out that there were 78% of those people said that they had no idea what their options were going to be under the Affordable Health Care Act. 78%, that's a big number, right? And now they did another poll in August, and it's down to 43%. Ooh, so we feel like we're getting some work done, right? Okay, so you say, great, Juanica, there's a lot of states here that are red, Florida's one of them. Are there enrolled people in every state, right? Because we're just an education coalition. No, there's not. We're in states like Florida and Texas because some other states did opt to expand Medicaid. They have state programs to make sure that they're rolling out the Affordable Health Care Act. But you guys won the lottery again, and you live in Florida, and they don't have those things. So we have a staff of about 23 of us that try to get out and talk to people and just let them know what their options are. States like New York, California, they have state-run programs that are investing in making sure that their people actually get out and have information about it. So right now there's a lot of confusion, I know, and you probably feel like, hey, we don't know what's going on, but that's why we formed the coalition, is to talk to people. So this is a demographic breakdown of what those uninsured people look like, right? Of that 3.5 million uninsured Floridians, 53% of them are males and 47% are females. A lot of times when we do demographic studies, we do them because people like to get information from people that they can identify with, right? You might want to hear information from, you know, your mom or somebody who looks more like you, or someone at your mess, or someone in your area. But when we did research, we found out that males actually like to hear information from maternal figures. That actually makes them want to enroll and do different things. Okay, and as of the age breakdown, we find that the mass majority of people that are uninsured are from the ages 26 to 54. They cover over half of the people that are uninsured. And that is because they're in a group we call the young invincibles. You know, they feel like we're not going to get sick, right? But we definitely like to remind them that young people make up about 70% of the trauma centers. We can't prepare for things that are unexpected, right? Emergencies, accidents. So these are reasons why, even if you're young, you definitely need health insurance. And down here is the ethnicity breakdown. 45% of that 3.5 million are Caucasian, 32% Latino, 15% Afghan, and 8% other. And in terms of the income, the federal poverty level rate. I'll never talk to you guys in terms of federal poverty rate, because if someone asked me, hey, Juanica, where are you to the federal poverty rate? Like, I wouldn't know, right? I'd know I was poverty, but I wouldn't know exactly where I was to that rate, right? So we won't speak in terms of this. However, I will let you know that the reason it's here is because the information we found is that 67% of the people who can't afford insurance right now, don't have insurance right now, actually have at least one person in their home who works full-time. That's important to know, because a lot of times people say, I don't want to pay for health insurance for people who don't work, right? Well, there's a lot of working Americans right now who don't have health insurance. And so this is just something that we know, in the beginning, in June, 78% of that number, 3.5, they said, we have no idea that the Affordable Health Care Act even passed, right? Like, they didn't know about it, and that it's down now. But the good thing is that 69% of those people actually said, we don't know about it, but we want to know about it. We want information. We want you to come talk to us. And so with this big number provided to us is the opportunity to do outreach and education. So I'm here today to answer your questions, but also to implore you guys to make sure that you're talking to your friends, talking to your neighbors, talking to everyone you know about the Affordable Health Care Act. I'll give you some information before you leave here today, and hopefully answer some questions so you can feel armed and know that you have all the information. So, I talk a lot by nature, but if you don't get anything out of everything that I'm talking to you about today, I want you guys to remember these four main things that the Affordable Health Care Act is going to help most Americans with. Now, these are our main messages. They resonate with 89% of the population. There's four of them. They're the most important. There is a quiz at the end, so remember them. Now, so the first one is all the insurance plans have to cover, it has to be comprehensive care, right? So they have to cover doctor's visits, maternity room care, emergency room care, prescriptions, and hospitalizations. Why is this important? A lot of people have insurance, but they're underinsured. Some people have insurance and maybe their prescriptions aren't covered or different things. So this is not just going to help people that don't have insurance. This is going to help people that don't have the complete care that they need. The second thing is you might be able to get financial help. We've seen a video just a minute ago and it talked about, brief things about some government covered things that it's going to help. But you might, depending on how much you make and the size of your household and a lot of other variables, be able to get financial help with the plan. The third thing is if you have a pre-existing health condition, you can no longer be denied for coverage. For me, that's awesome, right? I have asthma, and there's a lot of people that say, hey, I can afford my own health insurance. They just won't cover me, right? Because I have all these issues. Well, now that's going to be a term that's no longer existent because of the Affordable Health Care Act. Also, no longer any lifetime limit caps, right? So that's awesome as well. And the last thing is all insurance plans have to show cost and what's covered in simple language. No fine print. You have to be able to understand what you're getting, be able to compare apples to apples, oranges to oranges. I went the wrong way. All right, so enrollment options. So you might be saying, Juanica, this is awesome, that's great, yeah. So what are my options? What am I going to get, right? Well, in 2014, there's 3 different options that are available to the uninsured based on your income, right? The first one is Medicaid. The elephant in the room is that Medicaid is not expanded in the state of Florida. In case you didn't know, we did not expand Medicaid. So this won't be changing. It's not going to affect your Medicaid if you already have Medicaid, if you already have insurance and it's comprehensive, it's working, it's fine. It's not going to affect you. Or Medicare. The second thing is the marketplace with financial assistance. Now, the marketplace, we touched on it briefly in the PowerPoint. It used an example like a store. You'll see a PowerPoint slide up here with some fruits and vegetables because I like to eat, and marketplace reminded me of food. But the marketplace can also, if you've ever used Orbitz or any traveling thing where you can actually compare all the prices, it's basically just a place where all of the insurance plans are in one place, and you can see all the copays, all the premiums, and everything in one place where you can compare and see what's going to be best for you and your family. And that's with financial assistance, and the marketplace without financial assistance. Can anyone give me an idea of why you might want to be involved in the marketplace without financial assistance? Huh?
Shop around.
Just shop around, right? If you have insurance companies, private insurance companies in one spot competing for your business, the prices might be lower than what you're getting today, right? So that might be a great reason or a great thing for you. Now, I said I won't get into Medicaid, definitely nonpartisan, but just in case someone doesn't know what Medicaid is in the room, Medicaid is a health care that the federal government sets the minimum requirements for. Historically, it's for low-income parents, children, pregnant women, low-income and elderly and disabled individuals. And Medicaid doesn't cover undocumented immigrants. And of course, it's that our state did not expand the Medicaid in our state. Now, in this portion, actually covers low-income parents and children and pregnant women. Can anybody see like a large group of people that we're missing? Yeah, just single people, right? Not everyone has kids, right? But there are some people that just are lower income and they're single and they want health care, right? So Medicaid typically doesn't cover that group of people. And that's why for this group of maybe young working people, we have a lot of people in the hospitality industry here in Orlando, different industries that maybe just can't afford health insurance right now through their jobs, where this is going to be likely for them a big option. Okay, so there's my fruits picture, of course. So this is the marketplace. Who is eligible to enroll in marketplace? If you're a U.S. citizen or in the country legally and you're not incarcerated, you are eligible to enroll in marketplace. So a lot of people ask me, well, what if I'm here? If you're here for any reason, you don't have to be a citizen. As long as you're legally here, you can enroll in the marketplace. It's going to cover all your essential health benefits. That includes doctor visits, hospital care, emergency room visits, prescription drugs, and much, much more. And of course, the marketplace opened on October 1st, and open enrollment is until March. But the coverage actually doesn't start until January 1st.
I don't want to forget that, but you have to be, you can't just be here, like, let's say someone's coming here on vacation for 3 months, or a student is coming here for only 4 or 5 months. They cannot enroll in the marketplace unless they're going to be here for the majority of time they'll be covered. So you sort of said like anybody can do it as long as they're here legally, but they have to be here for a certain period of time. I didn't want that to go by.
All right.
And introduce yourself very quickly, Anna, so if people know who you are.
So I'm Ann Packham, and I'm one of the navigators that helps people do the on-the-ground enrollment.
So we get to hear from her a little bit later,
Yeah.
okay? Okay, thank you.
Sounds good. All right, now who is eligible for financial assistance? Well, you're eligible for financial assistance if your income is less than 400% of the poverty level. I told you guys I was not going to talk in terms of poverty level anymore, so I'm not. I'm going to give you a number. That is for a single adult if you make less than $44,680. And for a family of 4, these are ballpark figures. Your household makeup and everything will vary, but for a family of 4, that's if you make less than $92,200. Okay? Now, you can't have an offer of job-based coverage if you're going to get financial assistance. So, for some people, that's the rub, right? They might say, I don't want my job's insurance, right? That's why I want to be able to take part in the Affordable Health Care Act, right? But can anybody give me just a couple reasons? You guys don't have to raise your hand. You can shout them out. Why, when people are unhappy with the coverage on their job, why would they want other insurance? What are some reasons people could be unhappy with job coverage? Premiums, deductive, expensive, right? Anything else? It might not be comprehensive, right? It might not cover everything. Well, the mandate is not just for individuals. It's for businesses as well. So the businesses are now going to have to provide comprehensive coverage for people. They're going to have to step the plans up, right? And also, it's going to have to be affordable to the people. I always like to give an example of, I come from a background of working for a Fortune 500 company. And in that company, there were 3 plans. It was married, single, or family. Those are your 3 options. Everybody pays the same amount, right? It didn't account for how much money you made or whatever. Well, everyone's individual income is now taken into effect, and it cannot go over a certain portion of your income. Depending on how much you make, that will depend on, it can't go over a certain amount of your premium. Okay? So, that's why you can't get financial assistance if you have an offer of job-based coverage. Are immigrants eligible? Yes, if you're a legal immigrant, and as Ann pointed out, definitely there's different restrictions for how long you have to be in the country. I don't do enrollment, I just do outreach and education, and definitely should be more versed on all the intricate ins and outs of it. So how exactly do you get this money, right? Are they going to send you a big check to your home? How do you get it? Well, you get it in a refundable advance payment federal tax credit. What does that mean? Are you going to get a check? No. What happens is when you enroll, you will get a tax credit. You don't have to actually wait until you file your taxes. It can be done immediately once you enroll, and then that will be applied towards your premiums for your insurance. Okay. Yes. Someone come? No?
Leave the question for the end, okay? Just keep
All
your
right.
question.
All right, good. All right, so now, remember those 4 points that we talked about that resonate with 89% of the population? I just wanted to do a quick check and see if you guys remember at least one of them, right? So can someone tell me one of the main messaging points that resonates with 89% of our population? Just one. One thing that now the Affordable Health Care Act is going to make us be able to do. One.
I think you guys need some sugar. That's why the cookies are here.
Pre-existing conditions, is that one?
Yeah, that's a good one. No longer can you be denied for pre-existing health conditions.
Very good.
That's very good. That's going to help a lot of people. A lot of people in my family have diabetes, high blood pressure, and all these things, right? And this is going to be able to make sure that they can get preventive care, not be denied and take care of themselves. Come on, we got 3 more. 1 more. Yes.
The healthcare is going to be comprehensive now. It's going
Yeah.
to cover your prescription, doctor visits, all the things that involve medical.
Comprehensive care.
You get a cookie.
Yeah, complete health care. Complete health care, doctor visits, everything included too. So we're 2 down, 2 to go. I think it's in head. Yes.
And the one thing is, some doctor, they are on a self-contract basis. So all these doctors, they see the patient, they will get paid.
Okay, well that's a good one.
You get 2 cookies.
Yeah, getting paid is a good one. Okay, come on. We got some more. We got some more, team. Let's work.
The affordable assistance, the financial assistance that they're gonna be getting from the government.
It's called the Affordable Health Care Act. So some people can get affordable health care, right? And the last one, I'll say it. It has to be in simple language, right? It has to be plain, easy for everyone to understand. Okay, there we are. You guys did great. You should give yourselves a hand. You got all 4. Good. All right. All right. So I know you guys are gonna have questions about this one.
Keep it for after the end of Q&A.